Hi everyone, I am Dr. Shahan and welcome back to my channel. Today in this video, I will talk about Chandipura virus. Chandipura virus is very recent in the internet and it is making the internet buzz because of the recent death that is occurring due to Chandipura virus. Now, what is this Chandipura virus? We'll learn about it. What is the diagnosis? What is the treatment? Everything we'll learn about this virus. But first, you have to see this picture. Can you see a fly in the picture? What is this fly? Can you identify this fly? You know this fly. This fly is the sand fly. Yes, this is sand fly. Okay, and that is the vector for the Chandipura virus. Chandipura virus. What happens in the Chandipura virus infection? I will tell you everything in this video details. So let us learn one by one what is happening. Now you can see Chandipura virus. Look at this slide. Chandipura virus, CHPV. The abbreviation is CHPV, is a member of Rhabdoviridae family. Rhabdoviridae family, which cause what? Which cause encephalitis. Very, very important. Encephalitis. Primarily in the children, it causes encephalitis. You know what is encephalitis? Inflammation of the brain tissue. And basically in Chandipura village, there is a village in Maharashtra known as Chandipura. In 1965, it was first identified in the Chandipura village of Maharashtra, and that is why the name is Chandipura virus. It is transmitted by phlebotomus, that is sand fly. I already told you it is very, very important from the exam point of view. Maybe in the next NEETPG or FMGE exam, they will ask. It will be transmitted by sand flies and cause acute encephalitis, and very high mortality rate is there in India. Now look at this. This slide is showing you the symptoms of the Chandipura virus. What are the symptoms the patient will have if the patient is having the Chandipura virus? Number one is the high fever. The patient will come with a high grade fever. Second is the vomiting, and that vomiting is persistent vomiting. And third is the altered mental state. The patient will come with disorientation. The patient will come with confusion. The patient will come with drowsiness. The patient will come with coma in severe cases. If the patient is having the severe infection, the patient will come in comatose state. You have to understand there are neurological symptoms also. There are neurological symptoms like stiffness of the neck, maybe meningitis like symptoms, sensitivity to the light. All these are important symptoms of the Chandipura virus. Now look at this. This is basically showing you what? This slide is showing you what are the diagnoses. The diagnoses are, number one, we can do the PCR. What is PCR? Polymerase chain reaction. Polymerase chain reaction, and that is RT-PCR. We can do the reverse transcription polymerase chain reaction. We can also do the virus isolation from the CSF, but that is very specific procedure. Or we can do the serology IgM antibody, or specifically we can detect the IgM antibody or IgG antibody. Specifically we can detect. Or we can go for immunofluorescence assay, and by that also we can determine. Or we can do the ELISA procedure. ELISA is also very, very specific for the Chandipura virus. So all these are done to diagnose the Chandipura virus. Now what are the prevention? There are several steps for the prevention. Number one is the vector control. We have to control the vector, because the vector is a sandfly, and if we control the sandfly population, then we can control the Chandipura virus infection. Number 2 is the personal protection. You can use the bed net, you can use different mosquito net or something net like structures, or we can also use insect repellent creams, insect repellents, or we can use we can wear some protective clothing to minimize the bites of the sandfly. If you can minimize the bite of the sandfly, then you can prevent the transmission of the sandflies, Chandipura virus, through the sandfly. Now, community awareness should be made by educating the community, educating the mass about this problem of Chandipura virus. There should be community awareness, and this can be done by the PSM people. They can prevent this. So you should learn about this. Now, next slide here, we'll learn about the specific care. What are the supportive care we can do for the Chandipura virus? Number 1 is the fever management. What is the treatment? There is no specific treatment, but we can do the manage the symptoms. Number 1, there will be fever. We can manage the fever with the help of acetaminophen, paracetamol. Hydration, we have to give IV fluids to the patient. Anticonvulsant, there will be convulsions in the patient, so we can give phenytoin to control, or diazepam to control the seizures. Respiratory support should be given, because maybe oxygen, the person needs respiratory supports, oxygen and other things. Intensive care unit patients may also be there. If the patients deteriorate, we can save the patient to the ICU and give the patient the supportive medications. And we should also prevent the complication. We should treat the headache, vomiting as usual. So basically, we have to manage the symptoms. There is no particular treatment till date. There is no vaccine, there is no treatment available for Chandipura virus. So how can we treat it? We have to just prevent it.